Hi, my name is Jawad Ahmad, and I'd like to discuss our paper, Spontaneous Bacterial Peritonitis before liver transplantation does not affect patient survival, that was published in Clinical Gastroenterology and Hepatology. The study was performed at the University of Pittsburgh. The real reason for undertaking the study was that really there is very limited data in this area. A few small pilot studies have suggested that the outcome after liver transplantation in patients with spontaneous bacterial peritonitis, or SBP, is actually very poor. This would be expected, as these patients typically are sicker, and perhaps they have infectious issues or resistant organisms that may become an issue after liver transplantation. The study is retrospective in nature and therefore is limited, but did have a large number of patients, so I think the actual results are somewhat valid and actually quite interesting. The study was performed over a 10-year time frame, straddling the introduction of the MELD score in 2002, and done at a single centre. What we found was that of the almost 1,500 patients that underwent liver transplantation in this 10-year period from 1999 to 2009, 80 of the patients had evidence of spontaneous bacterial peritonitis, or SBP, prior to transplant that had been appropriately treated with antibiotics, albumin, and patients have been placed on prophylactic antibiotics. When compared to the almost 1,400 or so patients who did not have SBP heading into transplant, patients with SBP were actually sicker, as shown by a higher MELD score of 23 compared to about 19, and a higher child score. They were more likely to be male and more likely to have alcoholic liver disease and to a certain extent hepatitis C. Cholestatic liver diseases and autoimmune disease really were not very well represented in patients with SBP. The primary outcome of interest was survival, and this really showed no difference at any time frame, 1 year, 3 years, 5 years, and even up to 10 years in some patients, between the two cohorts, despite the fact that patients with SBP were sicker. When we looked at secondary outcome measures, such as morbidity in terms of having to be taken back to the operating room, and infectious complications, these were higher in the SBP cohort, but not so high as to affect survival. Of the deaths that we looked at in all patients, patients with SBP were more likely to die of an infectious cause within the first year compared to the non-SBP patients. But these were not with similar organisms as to prior. But there really was no difference in terms of the difficulty of surgery, in terms of the time in the operating room, transfusion requirement, or even in terms of overall biliary or other vascular complications. I think the study shows that it's important, even though anecdotes might suggest that patients don't do well, to do studies if at all possible, even though in liver transplantation it is a challenge to do prospective studies. I think another study worth doing would be to look at if there is a selection bias in terms of patients with SBP already not being listed for transplant when they present for transplant evaluation, or whether they end up dying at a higher rate, which you would expect since they do have a higher MELD score. In fact, some preliminary data from our own centre suggested that 38% of patients with SBP who were waiting for liver transplant actually died before receiving an organ. I think this is something that's worth looking at in the future. Thank you very much for your attention.